everyone. So now we are going to look at spinal anesthesia and its other components. Like we will be looking at how it is different from general anesthesia, what are its prerequisites, and what are some important points that should be kept in the mind. So, neuraxial anesthesia. There is a term that is neuraxial anesthesia. Neuraxial anesthesia is regional anesthesia administration of medications to block central nervous system and spinal cord, and there are components like spinal anesthesia, epidural anesthesia, and caudal anesthesia that is known as neuraxial anesthesia. These are three components of neuralgia. So, role of neuralgia and neuralaxial anesthesia is to avoid general anesthesia complications and to manage the airway or breathing circuit system. Like in if we have to paralyze the perineal area, we have to do spinal anesthesia. If we have to do some locals, so that is local anesthesia. So to decrease blood loss, we do these to decrease blood loss or to prevent airway obstruction, to lower risk of thromboembolism, to lessen nausea and vomiting. It is rapid onset, especially spinal. It takes place faster as compared to general anesthesia and useful in obstetrics and lower limb surgeries, abdominal surgeries, urological and gynecological surgeries. But there are certain limitations to neuraxial anesthesia, like there is risk of hypotension with bradycardia. This is the risky factor thing that happens in spinal anesthesia. We have to take care of blood pressure of the patient to prevent any complications. There is risk of hypotension and bradycardia, and it may not be suitable for procedures above the umbilicus T10 unless higher block is achieved. Like now, dermatome of umbilicus is T10. So if there is blockade above umbilicus, so it is not applicable. So we have to take care for that in neuraxial anesthesia. So this is neuraxial anesthesia. Like we perform this to prevent general anesthesia complications and some other complications like hypotension and bradycardia.